So hi everyone, more often than not I have seen lots and lots of students who find it extremely difficult to decode any kind of an MCQ which are related to porphyrias. Because porphyrias are not a single disease, it's a constellation of group of diseases which has got similar names, and also the enzyme defects, the substrates which are getting accumulated, the diagnosis and treatment modalities, symptoms, signs, everything actually varies for each and every disease. Okay, and they also get overlapped. So because of this, I have seen lots and lots of students who find it extremely difficult to decode any kind of a porphyria question, if at all they get something in as an MCQ. So this session is all about decoding those kind of difficulties with regards to porphyria. So we will see in an MCQ point of view, so that it gives more perspective for your understanding with regards to all the difficulties you face with porphyrias. Say for example, just see this question. A 30-year-old male who has been presented with history of abdominal pain, episodes of confusion as well as psychiatric problems. The lab tests reveal increase in urine delta aminolevulinate as well as porphobilinogen. Mutational analysis will most likely reveal what? So in this, you need to first analyze the symptoms, and they have given a straightforward clue to you. It is the lab test which actually has revealed the exact defect. I mean, like, there is an increase in delta aminolevulinic acid as well as porphobilinogen. Okay, so once you decode and once you find the disease, you need to know what kind of enzyme defect will cause the disease. Okay, so after finding that only you can answer this question correctly. You can see the options given. It's more or less all the names will be similarly sounding, and there is a chance of you getting confused. Okay, so let me try to decode this. Let us see together one by one how to solve this kind of MCQs, porphyria MCQs. Okay, now I am not getting into much detail of porphyria. This session is just about outline of all the porphyrias, so that you, once you see this tabular column, you get an overall understanding of all the porphyria, and with each and every step you can easily try to decode all this kind of MCQs. Okay, so porphyrias can be presented with three major types of symptoms. Okay, the first major type of symptom will be presence of neuropsychiatric or neurovisceral manifestations. Okay, so this is the first symptom in various kinds of diseases with regards to porphyria. Neuropsychiatric or neurovisceral manifestations. Neuropsychiatric means the question will be having clues that patient is having some kind of a psychotic disorder or some kind of a psychiatric disorder, and neurovisceral manifestation will be manifested in the form of acute abdominal pain. Okay, so these will be mentioned specifically in the question itself. Okay, now the another group of manifestation will be cutaneous photosensitivity. So what do you mean by cutaneous photosensitivity? Cutaneous photosensitivity is a thing you are more photosensitive and it is visibly seen in your skin once you are exposed to sunlight. Okay, so this is called as cutaneous photosensitivity. Okay, the third group of manifestation will be combination of both neuropsychiatric, neurovisceral as well as cutaneous photosensitivity. All three manifestations will be present together. Okay, so the first step itself will, you can exclude various other kind of diseases with the first line of the question itself with regards to the manifestations. So either the patients can be grouped under manifestations having neuropsychiatric or neurovisceral, or they could be presented only with cutaneous photosensitivity with no neuropsychiatric or abdominal pain, neurovisceral manifestations, or they could be presented with combination of both neuropsychiatric, neurovisceral as well as cutaneous photosensitivity. Clear? Now, the second thing is about the origin of porphyrias. So, the origin of porphyrias, once you start finding from where the porphyria has originated, it can be from two things. First one could be your liver. So, it could be a hepatic origin or it could be a erythropoietic origin. Okay. So, hepatic or erythropoietic. Okay. Now, all the porphyrias which comes under neuropsychiatric or neurovisceral manifestations are always hepatic. They are hepatic porphyrias. Is it clear? So, the question, it shows neuropsychiatric or neurovisceral manifestation. It means the porphyrias will be only from hepatic origin. Are you clear with this? Fine. Now, in case of cutaneous, the origin could be mostly erythropoietic. Please note the term mostly, because we have got 4 diseases, 4 porphyrias which comes under cutaneous photosensitivity. But out of those, 3 porphyrias will have erythropoietic origin and 1 will have hepatic origin. Okay. So, this is all about cutaneous photosensitivity, and in case of combination of both, again it will be hepatic. Okay. So, as you can see, if you find any kind of a neuropsychiatric or neurovisceral manifestation, it has to have its origin from your liver. Okay. It should be your hepatic porphyria. If at all it is an erythropoietic porphyria, it will not show any kind of a neuropsychiatric or neurovisceral manifestation. It just presents itself as cutaneous photosensitivity. So, are you clear with this?